primitive.
Was built in the 1950s.
Yes,
Yes,
1956.
it's a very large structure, very big wards. They do have what they call high-cost and low-cost areas of the hospital. The low-cost areas are for the really indigent population, and that's where our focus was. The high-cost areas are for people that have, I guess, a little bit of means, some resources. But the hospital, takes care of
It's a charity
tremendous
hospital.
population because they're a referral center.
Right.
So there may be, for example, a mom in labor at an outlying local clinic or at home that, has trouble, and then she's got to be transported to that hospital for care if things aren't going well. So they do get a large influx of patients from the surrounding region.
Emery, earlier you would tell me some statistics. You want to read some of the statistics for us?
It's Zambia, which is where it's in Central Africa, kind of more in the, it's not South Africa, but it's more southern. Population of over 12 million. Half of the population live on $1 a day, so very, very poor. The average life expectancy is about 40 years. 45% of the population lack access to safe sanitation. 42% lack access to safe water supplies. It's estimated about 17% of the population is HIV infected. And in 2005, there was 100,000 people that died of HIV, leaving over more than 500,000 children orphaned. So it's a real issue. The HIV rate, infection rate, is stabilizing because of the efforts of the U.S. and all around the world in terms of testing, education, and also providing medications, antiviral medications. That's pretty much throughout Africa. So that is definitely improving, but it's still a huge issue, and it is catastrophic for those children that are left behind because there's no infrastructure to take care of those children. Very, very limited, in terms of orphanages or family members.
I have to say, I was in Africa in '89. And I went to, I did like a cruise. It was on a mission trip as well. But we did go actually on a cruise ship, and we stopped at different ports. And I was in Mozambique. And I'll just never forget this. And sometimes it gets me a little teary. But I saw all these kids with kids. And I had no concept until after I came back to the States. And I saw something on television. And I was like, I just started crying. I was like, oh my God. Because at first I was saying, where these kids' parents at? They're out here with the, no concept. But that's, that's the, that's how we think, I guess, and not really knowing and not being educated in what was really going on.
Of how severe.
And how severe it is.
The impact of HIV is.
But when it wasn't until after I got home, it hit me because it was a lot of kids with little kids. They were like 7 and 8 years old with 2 and 3 year old.
Caring for younger siblings.
Caring for the younger siblings.
Yeah.
The first year we were there, that we arrived in the capital of Zambia, Lusaka, and there were big signs, big billboards, and there's so many street children that they're trying to get into orphanages. But what was happening is that people were giving money and clothing to them, and they weren't getting into schools. They were living on the street. So there's big initiative, it's, not to give them money and clothing because they would not go into the orphanages and get the proper care that they needed. So so it is improving somewhat, but it's still a huge, huge issue. And particularly and these are children that, unless they have someone, it's obviously not a regular source of food or money for them, but they don't have access to food, water, and shelter, and obviously not going to school. So it is really a tremendous, tremendous hardship that exists in that country.
But I think what you guys are saying, you're adding on to the educational piece of it. I think that's pretty critical at this point, and I think it's very wise because we can come in and do what we do, but if they're not educated.
Well, there's the other issues with the children even though it is not a famine country, they're not undergoing a famine. It depends on basically rainfall, and so they haven't had a significant drought in a number of years. There is a lot of malnutrition in the children.
Yes.
At the hospital, there's a malnutrition ward. It's actually a freestanding building where they have many infants and toddlers that are either have kwashiorkor, that typical thing we see, the swollen belly.
Yes, yes.
And that's from protein deficiency because they're not getting protein. And then merismus, which is the muscle wasting, where you see the
very thin.
starvation, the real starvation. They're not getting calories or protein. What happens is when the infants are now, when they're weaned from their mother, they only have access to their main staple food is it's a maize and a rice poultice that they eat. It has calories, but it has no protein or
Is that
iron.
what you see on TV? It looks like
It looks
mush,
like
a
mashed
white mush?
potato. It looks like
Yeah.
mashed potatoes, but
Right,
it's
right.
rice and
So what's lacking in it?
no
Protein.
protein
The
and
protein.
iron. And iron. So the children will then, if they don't have access to obviously protein sources, because usually animal protein has iron along with it, they first get anemia, and then it progresses to either merismus or the kwashiorkor. And then what happens is that these children are already at a huge disadvantage. The cards are stacked way against them. They're not, even if, then, of course, you have to have access to education. So even if they are schooled, because their brain development is already blunted, so they're going to be learning disabled, or they're not going to be able to learn. So it's a cycle of poverty,
Wow.
So then they grow up not having the trade or skills to be self-sufficient, and then the cycle of poverty continues. So that is a huge issue. We're dealing with the medical, and whether it's surgical or in the clinics, one of the things we're hoping to expand is to provide an educational piece for children, to provide some support or some sort of scholarship to help the children, particularly in this area, to be able to have some funding, because it doesn't take very much money to send a child to school.
Right.
But they have to have access to food.
Yeah.
And also shelter, and so it's food, it's shelter, it's health care, and that's what needs to be in place. And obviously, if they can get educated, then they will. That's how the cycle of poverty is broken.
Yeah.
Wow.
So it's a huge undertaking.
So I know we had a fundraiser here before you left,
Yes.
and it was just so exciting to be a part of that, to be honest with you. That's, I think, that's ongoing. Do you continue to do the fundraiser? Why are you, because before we leave, I'm going to have you maybe to give a number maybe, or somebody contact, or maybe not. Or maybe we can have them.
We don't have a
The nu-
planned
yeah.
fundraiser right
No,
now,
you're
but we
right.
probably will have one before the next trip next year.
Okay.
Yeah.
But Raphael Ministries comes out of the church and
Community Bible Church.
And
North
where is that
Sea.
located? In Sag
Harbor.
In Sag Harbor.
So if anybody wanted to donate, all donations go directly to the cause. There's like no, administrative fees or whatever. So every dollar we get goes directly to our work and what we need to do to treat the population and the patients.
I'm almost hesitant to ask this question, but how much money do you guys probably need when you go on these trips? I mean, you guys probably.
We pay for our own way.
I was going to
Yeah.
say that you guys probably pay for your own way.
Yeah, we pay our own way.
way.
All of the volunteers
Yes.
pay their own way. Some people are able to do it out of their own funds. Some people
Get
are able
sponsored.
to find
Yeah.
sponsors or raise money through their churches or their families or
Yeah.
their friends.
But I'm thinking about all the medical.
All the
all the medicine and
supplies,
everything
the medicine
and the
itself
supplies.
is tremendous,
I
because we
can't-
have to buy every antibiotic,
Yes.
every malaria medication, all of the other ancillary supplies that go along with
We
it, which is
actually ran
massive.
out of medication.
We did. We had to actually
Really?
we ran out of pretty much everything on the medical piece of it. We had to go into the villages,
The
to go
local
to the
pharmacies.
pharmacies to buy medication. And actually, one of the volunteers actually out of his own money, out of his own pocket, paid for that additional medication, which, was really
Could you give
wonderful.
us maybe a ballpark figure, though? Just how much maybe?
I think that Scott said that
the supplies and all
the
that?
trip costs about $140,000 to
That
fund
sounds
every
about
year.
right, yeah.
But I mean, to treat over 800 people
Yeah.
in 4 days.
And the surgeries, and, yeah,
You guys are
69
more than
surgeries.
instruments, it's angels. I mean, I just can't even imagine 4 days, 800 surgeries.
69 surgeries,
I
800
mean,
patients.
69 surgery and 800
800
patients.
More than 800, actually.
That is just
It was a
tremendous.
tremendous amount of work, but you know what? That's what we went to do.
I'm almost speechless right now, but I just want to thank you guys and all the other people who went. I mean, you said how many other
20,
volunteers
26.
were?
It was 26
26
altogether.
People told.
And these, were they all out of Southampton Hospital?
No,
There's
a lot from Stony Brook.
yeah, there's
lot.
a group
Yeah.
from Stony Brook as well, nurses, physicians, nurse anesthetists, and volunteers,
Yeah.
as well as the group from Southampton.
And also, anybody who's interested in volunteering, you don't have to be a nurse or a physician to volunteer. We need, helpers. We've had, we had actually someone who is an EMT, a local EMT, and he was very concerned about not being, useful, and he was invaluable to us in terms of helping and assisting us. So you don't have to be a medical person to participate in the mission.
I think I've told
important.
Dr. Ralston 2 years now I'm going to go. So next year, I seriously, I plan to go. And could you look at the camera one more time and tell the church, name of the church that people can donate to?
If anyone wants to donate, they can send donations to Community Bible Church in Sag Harbor, in care of Raphael Ministries.
Thank you, ladies. This has been a great show, very informative, and my heart is just overwhelmed to think about all that you guys did.
Thank you, Brenda.
It's awesome. Thank you very much.
Thanks for having us.
Thank you, and have a good day.